My name is Chris. I'm a Hospital Services Group registered nurse for DaVita. I work in the hospital doing dialysis on patients who are admitted for something else but still need their regular dialysis treatments.
So for a routine treatment in hospital, anything that's bedside or an ICU, we take the machine to the patient. We bring the treatment to them.
We see any patient that's in the hospital that needs their dialysis treatment. We've seen patients as young as 2 years old, all the way up to 90. The whole lifespan, basically. If they are in need of dialysis, then we can provide that. Coming into the Hospital Services Group, knowing little or nothing is not a bad thing at all, because DaVita is going to show you exactly what you need to know. And then your questions will follow. They will show you, they'll mold you, they'll train you to learn the right way to do things. We have such a cohesive team where we really support each other. I can depend on any one of my teammates if I have a question about a machine or a setting, or something popped up with a treatment that I'm not sure how to handle. If I can't get a hold of my coworker, then there's clinical coordinator, my charge nurse, or my boss, or my boss's boss. Everyone up that chain is available, and they're all there to support and help. I can absolutely count on my teammates anytime.
I wish other nurses knew that when it comes to working with DaVita, as far as nurses go, I think that we know that we make investments in the hospital, the organization that we work for, and we put our heart and soul into our work. But DaVita, unlike probably most companies, they actually reinvest back into us.
Sometimes the days are shorter, sometimes the days are a little bit longer. It all depends on the workload, how many patients are at the hospital that are in need of dialysis. It also helps to know that the work that you're doing is very important. And if your loved ones know that the work you're doing is very important, that there are literally people's lives depending on the work that you do, then they understand. In my 15 and a half years of being a nurse, I haven't been anywhere where I felt more supported or happier or more content in the immediate effect that we can have on patients, the impact that we can have. I would say that if the door opens to land a position at DaVita, you absolutely have to give it a shot.